chained against the door. Today's discussion is on mental health, and the title is Postpartum Depression. Depression and mood itself, causes and treatments. The name is H. Kwame Afaglo. To start with, sometimes we blame women who are pregnant or being weird when they give birth. A year during pregnancy and after giving birth, some of them withdraw from the rest of the family. Some of them don't touch the baby. They feel as if they are so bad a mother, so they don't touch their babies. They don't bond with their children. And then onlookers or the family think that that person or that lady is a witch. So they send that mother neonatal situation to the witch camp. That is wrong. It's nothing but depression, what we call postpartum depression. Sometimes the chemicals in the brain, especially the ladies, hormonal chemicals, has its own way of controlling the body. And so when they give birth or when they are pregnant, some women, when they are pregnant or they give birth, they become a bit strange. They get withdrawn. They don't want to touch their babies. They don't want to do anything close to anybody. They feel so bad of themselves, so down, and it's postpartum depression. Please don't send such patients to the religious homes. Send them straight to the mental hospital or to the psychologist. There are various steps we'll take care of at that stage. That's just one of them. Then you think of it again. What about children? Some children go through a childhood depression. Such childhood depression is such that the children feel so empty, hopeless every time they are sad, persistently sad, weeping, and as if they keep telling you that they are incompetent at anything. They are just incompetent at anything. Yes, it is also childhood depression. Children have depression. They have mood swings. Some of them get angry and they fight at school, do all sorts of things. They are always in the bad books, the so-called bad books of the teachers, because they are doing almost all the naughty things, and there's always problem for them. That is childhood depression, and that also is a mental disorder or a psychological challenge, mental illness that needs to be taken care of by the psychologist, or that's for therapy or psychiatrist. Don't think those children are bad children. They can be turned around. Nobody was born bad. Everybody was born a good person if the environment permits that child or that person to survive and survive well. All right, that's the second one. What about mood? Sometimes somebody feels so sad persistently, continuously. They always feel sad, irritated at anything that comes their way. They feel so hopeless, empty. I mean, they just can't do anything. They are always tired, sleepy or sleeplessness, insomnia. They don't sleep throughout the night nor the day. And it's just this thing that is not right with them. It's persistent. That's a mood. It's a mood problem, and it's depression. That is also another mental ill condition that has to be looked at. What about bipolar? Where sometimes the patient starts smiling at something that you don't know. They just feel excited, excessively excited, and continuously excited. Sometimes they swing to being moody and withdrawn from everybody. And sometimes, they are smiling and happy, and there's nothing to understand. When you ask them why are they happy, they don't even know. They can't tell. They are always smiling and happy, excited, over energized. Sometimes they think they are Superman, and a lot of that happens to a lot of world leaders. Be mindful. A lot of world leaders go through this bipolar situation. A good number of them, rather, go through bipolar. So be careful. Everybody has one form of a mental ill situation or the other. Maybe you've not discovered yours, but if you've discovered it, you want to find out what's the cause and then the treatment. Here some of them comes. If any of them postpartum, that's during pregnancy and after pregnancy, a year after pregnancy, one goes through depression or childhood depression, or just mood, just being moody all out continuously, then of course that's another problem. Or is bipolar, where one swings between what, being excessively withdrawn or being outgoing, seem to be the champion, as if he is the delusion, the grandeur, is a big man, he is the one who carries the world on his back, atlas and stuff like that. That is delusion, the grandeur. When they say it, everybody must command. If you don't, then they don't understand why. They want to crack everybody up. That is delusion de grandeur. It's also a mental ill condition. Just be mindful. Postpartum sometimes has got to do with the hormonal imbalances of the person. Maybe childhood depression also does. Sometimes poverty does that. When people are always thinking and thinking and thinking and just not being excited, it could be one of them. It could be that they are at risk because it's a family issue. They pick it from some family members. Such risk must be known. And if they are known, how do you treat them? One of them is to go to the psychiatrist. If you know you can go yourself, or someone else takes you to the psychiatrist. If not, the psychologists are there also to assist. They can go about looking at thinking or discussing through such therapy with the patient and finding out what is making that person so moody or sad, just helpless, unable to sleep. They identify it and then they correct the situation, meaning that they make the person feel good. If it's alcohol anonymous, the person is on drugs, and so the person is always moody or depressed, withdrawn, yes, that can also be sorted out by a psychologist. So you could combine both, either the psychiatric treatment and the psychotherapy. But then there's another one, light therapy. So sometimes it's always good that everybody should come out into the sun and walk through the sun for some hours each day. The little sunlight you get is better. So then if it happens, they can take one through. If such illness happens, they can take the person through for light therapy. I think the time is going so far, but then let's just finish somewhere here with exercise and then religious practices. With exercise, we are saying one of them is Qigong, which is a Japanese exercise. You take it, you breathe in and then you breathe out. That is also another. You go through the exercise. You can watch it on YouTube. Yes, Qigong. You can watch it on YouTube. You can learn it and practice every morning to improve that mental ill condition one has. Then what about joining alcohol anonymous situation if it's drug abuse? Then of course you make new friends and you learn new things. You associate better. Then religious organizations, some religious organizations, because you're a member of the group, either choir group or youth group or something, you tend to associate and you learn to improve from that moody situation, that sad, learn helplessness or helplessness, just being empty, feeling withdrawn from everybody. Children feel withdrawn and want to commit suicide. They are suicidal. Those mood swings goes from postpartum, from lactating mothers or pregnant women through their lactating period, all the way through childhood depression, which is suicidal attempts also happens to children. Let's be mindful. The name is H. Kwame Afaglo. We'll continue this. Thank you.